am Cindy Schwartz. You are listening to Planet Vero Radio, and we are talking about Modicine patient wear, patient garments for surgery, for medical procedures. And on the phone, I have Danielle Rivera, who is the director of Modicine Patient Wear. And this is kind of a second segment, Danielle. We were talking about this the other day, and the topic is phenomenal. It's just kind of cutting edge. People need to know this thing. Surgery is a scary proposition. I don't care who you are. If it's a first-time surgery, I know I'd be scared to death knowing what was going to happen or what's not going to happen. You really don't know what's going to happen. And so we want to have our dignity intact. We want to have some humility. Patients want to have kind of some say. And so let's talk about what your company is doing with Modicine Patient Wear.
Well, thank you, Cindy, for having me here. And so briefly, again, just to give an overview, Modicine Patient Wear is high-quality surgical undergarments that were designed for patient comfort and dignity. And so our goal is to advocate for patients who are undergoing surgery who may not otherwise be aware of the numerous times they are exposed or naked during surgery, and provide them with the option to keep their dignity intact.
And because people don't know, honestly, we've talked before how many people are actually in the operating room with the patient while they're having surgery. I mean, it could be 10, 12, 15 people.
Very likely that you can have as much as a dozen people in the operating room. You have your surgeon, your residents, nurses, circulating nurse, assistants, techs, aides, sales reps.
And you also have, if you're in a teaching hospital, there might even be more personnel because they're watching that operation, especially if it's one that's not performed very often or one that's kind of intricate, and they're all learning.
Correct.
Yeah. So the patient wants to keep themselves covered up as much as they can. That's the patient input, because once you really literally are wheeled into that operating room, you're at the mercy of whoever is there in charge of you.
Correct. Each facility is different. Some will make an attempt to drape you with towels or use a linen to cover you. At numerous facilities, you are stripped naked. The gown is removed, and you are at the mercy of whomever is in that room, fully exposed.
And we're neither one of us are doctors, or I'm not a medical person. I've never gone to medical school, and I don't, I wouldn't really talk about that. But do you really know, is there a reason why that happens? Is it because of sterility? Is it because of ease of the patient access?
It could be numerous things. Being a clinician, we are concerned with the infection rate, but we do treat all of the Modesty garments with an antimicrobial spray, which does not allow for the spread of infection, bacteria, viruses, algae, but it is also just what's rarely available. There is nothing on the market today that provides a Modesty bra for a female patient to wear during surgery.
And, female patients really don't have to be, this is my opinion, don't seemingly have to be totally naked, say if you're going in for hand surgery or, foot surgery or for surgery on your leg or even brain surgery. I would think not.
It's entirely up to the surgeon. You'll have certain procedures if it's a hip or where the patient's allowed to wear an upper garment, or vice versa. If it's an upper extremity procedure, the patient is not allowed to wear a sports bra, but she may be able to wear underwear. It varies. And then you have some surgeons that won't allow them to wear anything.
Underpants on either a male or a female patient,
Correct.
regardless if it's hand surgery, neck surgery or whatever. It just depends on, it's definitely by the surgeon's preference.
Yes.
So a patient, if they want to buy your Modesty garments, they want to purchase them, what do they have to do to ensure that they will be able to wear those for their surgery?
So we at Modicine Patient Wear will advocate for the patient. So if we receive a patient inquiry that they have an upcoming surgery and would like to purchase either the Modesty bra or Modesty brief for their surgery, we will contact the surgeon on their behalf. We will provide them with information on the antimicrobial properties, exactly what the patient is going to be showing up to surgery with.
Wearing.
Correct.
Okay. And do you find, Danielle, how long has Modicine Patient Wear been available?
We are brand new to the marketplace, so we have only been about for, I would say, 6 months.
Okay. And so has it become your experience that people are asking about this, that surgeons are allowing this?
We do have surgeons who are utilizing the undergarment in some of our hospitals and local surgical facilities. And we've also received patient inquiries from all over the state that are interested in purchasing the garment, and we have contacted their providers on their behalf.
And so you're talking from Chicago, Illinois, so you're talking about the state of Illinois, and the word is gradually getting out there that this patient wear is available.
Correct.
Okay. And the bra is available for $25, and the briefs are available for $20. Is that right?
That is correct.
Okay. And there's different sizes for each of those?
Correct. 3 sizes available for the Modesty bra, and there are 2 sizes available for the Modesty brief.
And when do the patients actually put these garments on before surgery? Is it in a pre-op room? Do they do it exactly in the operating room right before the surgery?
Pre-op is ideal. We advise the patient if they are not receiving it from this facility. So again, if the facility has not purchased the garment and the patient has purchased it themselves and is bringing it, we do advise that they keep it in the package and show up to the surgical facility or hospital with the garment in the packaging. And at pre-op, they will put on the garment.
And so that ensures that whatever sterility applications that your company has done, they're still intact as the patient goes into surgery.
Correct.
Okay.
It is a single-use garment for surgery. Mm-hmm. However, we are finding women are utilizing the Modesty bra after surgical procedures because of the comfort and ease of applying. It can be washed, mild dish detergent, hand soap, and that antimicrobial property will stay in contact on that garment throughout the lifetime of the garment.
That's very interesting. So if a patient has a certain procedure that they still have to wear, say, a modified garment because of whatever, procedure they had, they can still keep wearing this Modicine patient wear.
Correct.
Wow, that's a big deal.
Especially for shoulder procedures where their rotation is limited. This is ease of application for the patient to apply.
So it seems like that these tube type bras are easy to put on and off.
Correct.
They are. And what about the briefs? I think I briefly read that it's like a one kind of design, one where a female patient would wear it a certain way and then the male patient would wear it exactly backwards.
Correct.
Okay, so it's just one kind of size fits all, one design fits all, and it just goes across the board of male or female patients.
Correct.
Okay.
That's to minimize volume, especially for our surgical centers and procedures, that essentially they can incorporate this into their culture to provide patients with dignity without having to bring on 20 different sizing options.
Right, for supply and demand, and it's just 1, 2, 3 sizes fits all, and it's just like the generic gown that they put you in and then take you out when you're in surgery. So Danielle, we have a couple of seconds left. Go ahead and give your contact information so people can become more aware and can buy these garments. Yes.
Anyone can visit us on our website at www.modicine.com. That's MODICINE. Or contact us by email at customerservice@modicine.com, or feel free to contact one of our patient care coordinators at 312-579-4032.
And I also want to mention real quickly that patientmodesty.org is another website that you can get a lot of information from. And Danielle, thank you so much for sharing with that. I know it's a great product, and I want to hear and see more about it.
Well, thank you, Cindy. I appreciate it.